Hi, everyone. Thank you so much for joining us this afternoon. We're going to wait a couple of minutes to let others join in while I also work on live streaming to Facebook. So just bear with me for 1 second as I get this set up. All right, and I'm going to get ready to share my screen as well. For those just tuning in, thank you all so much for being here today. We are so excited to put this on today about Social Security disability insurance and the benefits that there are, and just sharing more information. It is always so important. So here we go. Let me share my screen quickly and then hit %. Perfect. So we're going to wait just 1 more minute to let a few other people join in. But thank you all for being here today to learn more about the ins and outs of getting approved for SSDI benefits. All right, so welcome everyone. Thank you all so much for being here today. My name is Nicole Hemmenway, and I serve as the CEO of the U.S. Pain Foundation. Today, we are going to be talking about a really important topic, and that is Social Security disability insurance benefits related to pain conditions. To start, I'm going to go over a couple of housekeeping items. Then I'm going to share a little bit of information that we have been recently posting around SSDI. And then I'm going to introduce you to our presenter today. We are so excited to have TJ Geist here with us to talk more about this important topic. So a few housekeeping items. Questions will be taken at the end. Please note, though, that we cannot answer any highly specific medical questions that might be pertaining to your individual case regarding SSDI. If you are tuning in through Facebook, please type your questions into the comments, and then we can ask them at the very end. If you are tuning in through Zoom, please type them into the Q&A icon that you'll see at the bottom of your screen. Please know that the chat is open, so we want you just to be respectful and mindful of one another's opinions and experiences. Also, I know that the chat is always a great feature to ask your questions, but it sometimes gets lost. So please, if you do have a question for TJ at the end, make sure that you do type it into the Q&A section. And just know that all of our webinars are recorded and they are posted to uspainfoundation.org/webinars so that you can find this and share it with others or rewatch it at a later time to learn some of the information and just have a brief recap of what we already talked about today. So a quick disclaimer, please know that this webinar is educational only. It is not meant to take the place of any conversation you have with your healthcare provider about your unique health situation, and US Pain does not recommend or endorse one therapy, treatment, or product. So this month, we focused a lot on SSDI benefits and just different aspects of the benefits and programs that are available. We published 3 articles with the help and collaboration of Allsup that talked about Social Security disability insurance for those individuals facing long COVID, the ins and outs of applying for SSDI benefits, and Social Security's Ticket to Work program. If you would like to read these articles, please go to uspainfoundation.org/news, and you can find all 3 of them there. There we go. Oops, I skipped there we go. So now I have the distinct pleasure of introducing our presenter, TJ Geist, who is a principal advocate at Allsup. He has over 18 years of experience with Allsup and subsidiaries. He applies his 15 years of Social Security disability insurance claims experiences with training and consulting roles, as well as industry expert on Social Security disability topics. He holds a bachelor's degree in exercise science from the Southern Illinois University, Carbondale, hopefully I got that right, and is a certified direct pay representative with the Social Security Administration. He is an expert on this topic. I've already been picking his brain before this presentation, and I'm so excited to turn it over to him to talk more about SSDI with all of us. So TJ, thank you so much for joining us. I'm going to stop sharing so you can share your screen.
All right, thank you, Nicole. It is good to be with you all today. Thank you for having me. As Nicole said, 18 years with Allsup, and majority of that time has been representing individuals for Social Security disability benefits throughout all levels of the process, including before administrative law judges. So also spent a little bit of that time the last 18 years working with the Ticket to Work program. So we'll share a little bit about that today as well. For those of you interested in a little bit of Southern Illinois Carbondale trivia, the mascot for Southern Illinois at Carbondale is the Salukis, which is an Egyptian fighting dog. So now you know a little bit more about SIU Carbondale. So let's jump right into the ins and outs of getting approved for SSDI benefits with pain-related conditions. So our objectives for today, my screen to move there, is we're gonna understand the importance of Social Security disability insurance and its role for working adults. We're gonna talk about the eligibility criteria for SSDI, and then we're going to talk about how the administration goes about making a decision. How do they determine whether or not someone meets the definition for Social Security disability? And then we're going to talk a little bit about some of the common diseases that are approved disability, and then take a closer look at some pain-related conditions, and then talk specifics about what things like what roles do providers play and how can they help in SSDI claims for cases that are related to pain-related conditions. Let's move on. So the agenda is, what is SSDI? Why does it matter? Again, understanding the eligibility and the assessment process. How can treating providers help? Why might individuals need representation? And then we'll talk a little bit about Ticket to Work and how that applies to SSDI, and then we'll have a time for question and answers, as Nicole said. So what is SSDI? SSDI is a federal program. It's a federal insurance program that's funded by workers and their employers through payroll taxes. So FICA taxes is funded through FICA taxes, and that's how the insurance premium is paid. Oftentimes, people don't think of it as an insurance program, but it is. It's an insurance program you have to be insured for in order to qualify. Oftentimes, people might think that it's a fund that I'm paying into. Social Security is a fund that I'm paying into that's accruing, and that's not quite how it works. It's more like an insurance program. It provides vital economic security to 8.1 million disabled workers currently receiving benefits. The average monthly benefit in 2021 is $1,277. So they call that PIA. So if you see that term in like your Social Security statement, that stands for primary insured amount. That would be your monthly benefit. Oftentimes on your statement, it'll say, this is how much you would receive if you were to receive disability. That's your primary insured amount. It's different than a program called SSI, or Supplemental Security Income. That's a different program, and we'll touch on that a little bit here. SSI is funded by general tax revenues, and it provides assistance to low-income individuals. There's no working requirement. You don't have to be insured for this. They're not dependent on work history or earnings. It's a flat amount. So for SSDI, the amount you receive monthly depends on your work history and how much you paid in FICA taxes over your work career. SSI is not that way. It's a flat amount. It's a set amount. And in 2021, it was $794, or is $794. That's getting ready to go up to, I believe, $821 for 2022. The medical eligibility for both programs is the same. So Social Security adjudicates them the same way. So there are technical requirements that are different. So for SSDI, you have to have paid into the system and be insured. For SSI, there's a means test to qualify. Your income and resources have to be below a certain amount in order to qualify for that. If it's above that, you won't qualify for SSI. And that resource amount is $2,000 for an individual and $3,000 for a couple. For SSI, you're automatically qualified for Medicare in most states prior to SSI approval. For SSDI, you are entitled to Medicare 24 months from the date that you start receiving disability benefits. And we'll talk about that here in a second. So what are the benefits of receiving SSDI? If I'm out of work and not able to work because of a disability, why should I apply for SSDI? Well, if you do apply and you are approved, you'll get regular monthly payments that are also adjusted for cost of living. So you get a cost of living increase for SSDI. SSI, there's not a cost of living increase every year. SSDI, there is, most years, I should say. For 2022, that cost of living increase is 5.9%. So it's a fairly substantial increase, the highest, I believe, going back, well, quite a few years now, several decades. A portion of these disability benefits for SSDI can maybe tax-free. I'm not a tax attorney for sure, so if you are an SSDI, you'll want to consult a tax professional on that. There's dependent benefits that come along with SSDI, up to 50% of what you would receive for children under the age of 18. So if you're getting $1,000 on SSDI, you may get $500 for dependent. And now if you've got multiple dependents, it would be split up between those dependents. So that 50% would be split up between the dependents. So if you were receiving $1,000 and you had 2 dependents, each dependent would get $250 to equal the 50% of your benefit. There's retroactive payments if you're approved SSDI up to a year from the date that you applied. So if you apply today and you are denied, or excuse me, you're approved, a year from now, you would get a year's worth of retroactivity benefits, depending on your onset date. It's a little more complicated than that, but there is a lump sum payment that you are potentially eligible for should you get awarded. It protects future retirement benefits. So SSA puts a freeze on your earnings record if you're approved SSDI. What that means is anytime you do not work in a given year, that puts a 0 on your earnings record, and those zeros go into an equation that they figure out your future retirement benefits. So if you have a bunch of zeros in your earnings record, that's going to reduce your future, it's going to affect that formula and reduce your future retirement benefits. So if you're approved SSDI, those zeros do not count against you. They put a freeze on your earnings record and freeze on your monthly amount. Medicare eligibility, as I mentioned earlier, is an incentive, or it comes along with the SSDI. Beneficiaries are automatically eligible for Medicare coverage 2 years from their eligibility for disability payments. So if your benefits started in December of 2021, you would be eligible for Medicare December of 2023. There's a waiting period for that. There's a waiting period to receive benefits as well of 6 months from the date that they find you disabled. They don't pay benefits for those first 6 months or the first 5 full months of disability. And with two exceptions on the Medicare and 1 exception on the date of entitlement to benefits. So if you have ALS, Lou Gehrig's disease, or end-stage renal with dialysis, you're eligible for Medicare right away. If you have ALS, Lou Gehrig's disease, you're entitled to benefits at the onset date. There's no 5-month waiting period for that condition as well. Receiving SSDI protects other income benefits, long-term disability, for example. If you have a long-term disability policy, oftentimes long-term disability policies require you to apply for Social Security disability. And if you're awarded Social Security disability, then long-term disability will generally offset whatever you're getting from Social Security and pay you a reduced amount on long-term disability. But they require you generally to file for Social Security disability, and oftentimes if you don't file, they'll start reducing your monthly benefit. Return to work benefits. So there are return to work benefits that come along with SSDI. They're available for SSI as well. They call that program the Ticket to Work program, and we'll talk a little bit about that. It essentially, from a high level, it helps you return to the workforce while protecting your benefits. So you can continue to get benefits for a certain period of time while you attempt to re-enter the workforce. So who is eligible for SSDI? Well, you must meet the definition, the basic definition of Social Security disability or disability under SSA's rules, which is you must have a physical or mental impairment that prevents you from engaging in any substantial gainful activity, SGA, for a continuous period of 12 months or longer, or which can be expected to result in death. So you have to have a condition that's preventing you from working. SGA is how Social Security defines work. And SGA for non-blind individuals for 2021 is $1,310. For blind individuals, it's a little bit higher, $2,190. So if you're earning that amount per month, Social Security considers you working and you do not qualify for SSDI. So that's the first general eligibility requirement. Second one is you must have worked at least 5 out of the last 10 years, which would make you currently insured for SSDI. So you have to be currently insured, and the basic definition of that is working 5 out of the last 10 years. There's a couple of asterisks there. For younger individuals, those under the age of 31, there are different rules. You don't have to have 5 out of the last 10 years because you're going to have a shorter work history, and so that's why they have special rules for those under the age of 31. You must be at least 21, however, to qualify for SSDI and have not reached full retirement age. SSI, there is no age requirement. Children can get SSI, so under the age of 21, you may be eligible for SSI. So once you've determined you meet the basic definition of Social Security or meet the basic eligible requirements, how does Social Security evaluate a disability claim? We're going to talk a little bit about that. And the way they do that, and they do this at the initial level, which at the initial and reconsideration level, the first 2 levels of the application process, that is handled by the state agency called Disability Determination Services. Once it gets denied there, it goes at level 3 or the hearing level to an administrative law judge to make the decision. You have an actual hearing before an administrative law judge. But they all, DDS and judges, they make the decision the same way, and that's through the 5-step sequential evaluation process. That's how they assess a disability claim. Step 1 is they look to see whether or not an individual is working above SGA. So if you file a claim and they look at your earnings record and they see that you're making over $1,300 a month, they're going to stop right there and they're going to deny your claim at step 1 because you're working. So they don't even get to the medical assessment at that point. It would be a step 1 denial. Step 2 is, so assuming you get past step 1, you're not working. Step 2 is, does the individual have a severe medically determinable impairment? Medically determinable is important there because you cannot file a claim and just allege that you have a disability. It has to be backed up by objective medical evidence. So it has to be documented in the medical evidence, and it has to be from a medically acceptable source. And we'll talk a little bit about that as we go along and talk about some specific impairments, but it has to be generally from an MD, a DO, a nurse practitioner, or some other specialist. Physician's assistants would also be an acceptable medical source. An example of one that's not an acceptable medical source would be like a chiropractor. It would not be a medical acceptable source. So step 2, in order to establish that you've got a severe medically determinable impairment, you have to have a treating history, right? You have to be seeing a doctor, and there has to be objective evidence documented in the records showing that you've got an impairment that would reasonably cause your limitations and symptoms. So once you get past step 2, and generally that's a pretty easy. Step 2 is generally one that most individuals that file a disability claim are able to get by, get on to step 3, because the definition of severe, it has to have a significant limitation in your ability to do basic work activities. So that's the definition there. And most of the time that's not a problem, and we move on to step 3. Where it becomes a problem is if claimants are not seeing a doctor, that's where it becomes an issue at step 2. Step 3 is, does the individual's medical condition meet or equal the severity of a listing? So Social Security has come up with a listings book, and they call it the Blue Book. It used to be an actual blue book that they would publish every year. They stopped publishing that in 2008, 2007, 2008, somewhere around there. But we used to get a book every year that had the medical listings in them. It's on the web. It's a web page now. But in the title of the web page, it still says Blue Book, actually. So if you search Blue Book SSDI, it'll come up. And what Social Security has done is they've broken up impairments into 14 different body systems. And within each body system, like body system number 1 is musculoskeletal. So if you've got like a spinal condition, the listing would be in that body system. And then there's criteria under each impairment that if you meet those criteria, then Social Security would say you meet a listing and they could approve you at step 3. So step 3 is the first place where Social Security can make a favorable decision. If Social Security says you've got a severe impairment, but it does not meet the severity or equal the severity of a listing, then they would move on to step 4. They would not deny the case. They would move on to step 4, which is can the individual perform any of his or her past relevant work? So work history and SSDI claim is very important. Past relevant work is any work that you've done in the last 15 years. They consider that past relevant work. And so what Social Security will do at that point is they'll come up with an RFC, a residual functional capacity, which is essentially what that individual can do based on the symptoms and limitations that they're experiencing. So for example, the individual might have difficulty standing for a long period of time based on the medical evidence, and Social Security might say this individual can only stand and walk for 2 hours out of an 8-hour day. What that would do would be eliminate light or medium type work, so work that requires you to be on your feet for the majority of the time. 6 hours out of an 8-hour day is what the definition of light or medium work requires. So if your past relevant work was light or medium, and Social Security finds that you can only do sedentary type work or work that requires you to sit for the majority of the day, then they would find that you could not do your past work, and they would move on to step 5. If they found you could do sedentary work and then your past work was sedentary, then they would say you could do sedentary work and you'd be denied at step 4. Step 5, if they move on to step 5, then it's can an individual do other type of work, or can they make an adjustment to other types of work? This is where transferability of skills comes into play. So if your past work was medium, but you've got skills that would transfer to a sedentary type of a job, then that they would find other work that you could do and they would deny it at that step. Age is a factor. This is where vocational factors come into play. So when you're under the age of what Social Security considers a younger individual, when you're a younger individual or under the age of 50, it's harder to be approved disability because Social Security believes that you could be retrained to do other type of work. Over the age of 50, that's less likely, and so that's where transferability of skills becomes more of a factor. And becomes easier the closer to retirement age you get. So the rules change again at age 55. So when you file a SSDI claim, what can you expect? Well, expect a long wait. It can take 3 to 6 months for Social Security to make a decision at the initial application, and that's even longer right now due to COVID. There's large backlogs right now at the initial and reconsideration levels. But the initial application can take 3 to 6 months. If that's denied and you have to file the reconsideration, the first appeal, it can be another 3 to 5 months on top of that to get a decision. And then if you have to go to a hearing, so the reconsideration is denied, it could take a year or more to get a hearing and to get a final decision from the judge. I say final, but that if you're denied at the hearing level, there are additional appeals. The appeals council, actually, right now the appeals council is taking the least amount of time out of all these levels. It used to not be that way, but right now the backlogs are at the initial and reconsideration levels due to the COVID and adjusting to the work processes. Most hearings involve a representative. That's generally where most claimants end up hiring a representative is at the hearing level. However, a representative can assist at the initial and reconsideration process. So all told, it could take 3 years or longer. with appeals to get a decision. Mentioned COVID-19 has had a huge effect on processing of claims. It's taking much longer. Also, we're seeing, at least internally, and at Social Security as well, an increase in claims because of COVID-related issues. So right now, Social Security has not adjusted their listings. They have not added a listing for COVID. They're currently assessing COVID-related impairments under their existing regulations. What we are seeing, they are tracking them, but they haven't changed the way they assess those. Data is showing that we're seeing a lot of neurological, respiratory, cognitive, circulatory, and other chronic disorders resulting from the infection. A common issue is, especially with those hospitalized for long periods of time and those having to be on a ventilator, we're seeing a lot of long-lasting issues there. For example, kidney issues, and we're seeing individuals who were not on dialysis or did not have kidney failure prior to the ventilator now having to have dialysis after being on the ventilator. There's a likelihood that there's going to be an impact going forward with those reporting long-term negative impacts on their health. So expecting an increase in the number of claims filed going forward as a result of COVID. So some common conditions by diagnostic group. So Social Security Administration annually reports data. This is the top 10 body groups or diagnostic groups that they saw in 2020. You can see at the top, musculoskeletal and connective tissue diseases were the number one. And then number two, cognitive neurodevelopment, behavioral mental health disorders are number two. That has been fairly consistent, I think, for as long as I've been working here. Top two categories are equal more than 4 million individuals. In 2020, 8,151,016 individuals received SSDI. So some common pain-related conditions. I said earlier, you cannot be approved Social Security disability based on allegations alone. So an allegation of pain by itself will not qualify for someone for SSDI. So documenting a specific medical condition with evidence of the disease its impact and the effects on work capacity is critical for a claim. That's for any claim, but certainly as it relates to pain-related conditions. So some of the common ones: spinal disorders, rheumatoid arthritis or other inflammatory arthritis. So psoriatic arthritis would fit into that category as well. Peripheral neuropathy, lupus, complex regional pain syndrome, Ehlers-Danlos syndrome, migraine disease, and fibromyalgia are some of the other common ones. Some of these conditions are easier to document than others. Some of the more difficult ones can be like migraine or fibromyalgia, or even the complex regional pain syndrome can be a little more difficult. So that's where it becomes important to document that, to make sure doctors are documenting all your symptoms and that you're expressing to your doctor everything that you're experiencing and the limitations. For migraine disease, one helpful thing you can do is to keep a migraine log. So that can be evidence. See your doctors consistently. For fibromyalgia, see a rheumatologist if you're able to, and hopefully they're able to document tender points. 11 out of the 18 tender points is what their Social Security is looking for there. Complex regional pain syndrome, there are certainly some physical manifestations of that Social Security is looking for. Things like change in the affected area in terms of skin and hair growth and things like that. So those are some things that Social Security is looking for in terms of documenting a severe medical impairment. 36 million Americans miss work due to pain in a single year. So a lot of Americans suffering from chronic pain. Ages 45 to 64 most likely to report pain lasting 24 or more hours. Workers lose an average of 4.6 hours of productivity time per week. Lost productivity It costs anywhere from 299 billion to 325 billion in the U.S. And 20% of those take disability leave from work as a result of chronic pain. So again, SSA gives little consideration to the claimant's statements about pain without objective evidence. So there has to be objective evidence. And said earlier, it needs to be from an acceptable medical source. Social Security is also looking for medications. So looking for medications that are consistent with pain relief. They're looking for also a functional capacity questionnaire. I mentioned Social Security at step 4 is going to determine how you're able to function, and there's nobody better to make that assessment than your doctor who has a treating relationship with you. So if your doctor is willing to complete an assessment, that's very helpful in a Social Security disability case, because then it's not just what you're saying you can do, but it's backed up by a doctor who's been treating you, and they can say this is what could be reasonably be expected in terms of functioning as a result of the impairments that this individual has. Comorbidities is a factor as well. One comorbidity is obesity. So if someone has a spinal condition, obesity is a big factor in that. It can make cause additional or more severe limitations and symptoms, as opposed to where obesity is not present. So that's a big factor. But Social Security does look at a combination of impairments. So if your primary condition is a spinal condition, but you've got other impairments, make sure those are listed on your application and that your doctor is documenting those, because they do take those into account. They're looking at the combination of those. Impact of pain. So your testimony is important in a Social Security disability case. Oftentimes, Social Security will ask, we'll send you a questionnaire to be completed, activities of daily living questionnaire, and what they're looking at there is how is your pain or other symptoms affecting your ability to function, your ability to cook and clean or shower, sleep, and that's very important in a disability case. That's actually what happens at a hearing as well. So at the state level, the first 2 levels, you do that in writing. At a hearing, you actually get the opportunity to tell the individual making that decision face to face or through video or by phone why you're not able to work. It essentially goes through your activities of daily living at a hearing as well. How can treating providers help? Document. List all diagnosis, record all treatment. Test results and screenings obviously are important. Exam findings and observations are very important. So the doctor might observe that the individual is walking with an antalgic gait, walking with a limp essentially. That's important. That shows the presence obviously of objective evidence that shows the presence of a severe impairment. They may require the use of a cane, and the doctor should document that in their records as well. Severity of condition obviously impact on your daily activities. Document that in the notes as well. One thing that I often see in looking at medical records is repetitive. There's repetitive notes sometimes in treating doctors' notes where it says the same thing overall, or it's templated, and sometimes they don't update it, so it says the same thing after every visit. Hopefully the doctor is changing that. So encourage the doctor to make sure that they're documenting what you're experiencing, what you're reporting on that day. Ask them to respond promptly to SSA's request for records. If Social Security doesn't get records, they'll deny a claim for not getting the records. So ask them to help there, and see if they'll help in terms of providing a functional, and by way of providing a functional assessment or a narrative letter describing how you're able to function and how your impairment and your symptoms result in your ability to function. Those are very helpful in a Social Security claim. One thing I do want to mention here also, because of COVID, I know there's been a lot of cancellation of in-person visits, and instead they've been televisits. Those pose challenges. Doctors can't observe everything or perform some tests that they would normally in person. Continue to see your doctor regularly via televisits, and make sure it's even more important that you explain everything that's going on and all limitations, all symptoms that you're experiencing in those televisits, so your doctor can document them. why individuals might need representation. Well, it's a complicated process. SSDI is a complicated program to navigate, and representatives can help with that. Majority who file get frustrated with denials and don't continue. There's a high success level at the hearing level, but a lot of claimants not end up getting that far because they get frustrated with the denials. The overall approval rate is about 35 to 40%. And oftentimes at the initial levels, especially, claimants, individuals are denied for technical reasons, and those are areas where representatives can help. They know the pitfalls there. They can help with obtaining medical records and things of that nature as well. SSA's got fewer resources and staff, and staffing levels continue to go down, especially because of COVID. And so they've got a lot of cases, and representatives can help prioritize their workload and make sure that they've got everything they need to adjudicate a decision, so it's not sitting on their desk longer. It can take as long as 2 or 3 years, multiple appeals, as mentioned earlier. National rates of representation, only about 27% of people use a representative with their initial claim, 69% at the reconsideration appeal, and 83% at the ALJ level. So again, once it gets to a judge, that's where most representation happens. The SSA Officer of Inspector General said if claimants had representatives earlier in the disability process, some of them may have received an allowance decision at the DDS level, saving them time and money. First, the claimants may not have to go to the hearing level if they had representatives to assist with them with completing SSA forms and providing the necessary evidence at the DDS level. This could have saved some claimants about 500 days in receiving an allowance decision. So representatives can certainly help. So Ticket to Work. What is Ticket to Work? Ticket to Work is included as part of your SSDI benefits. It's a free and voluntary program. Social Security, much like they used to publish the Blue Book, they used to send an actual ticket in the mail with your award that you could use with little explanation oftentimes there. So it's not a program that has been well publicized. I believe there still is a pamphlet in the award letter that describes Ticket to Work. But what Ticket to Work does is it protects your monthly income while you explore a return to work. So currently SSDI recipients between the ages of 18 to 64 are eligible. That's a typo there. That should say current disability recipients. So SSDI or SSI between the ages of 18 to 64 are eligible. And it does offer return to work incentives. What are those incentives? Well, you've got a trial work period in that where you can earn as much as you are able to for the first 9 months and continue to receive disability. So you continue to receive your SSDI payment for the first 9 months while you're working. So once that expires, once you've used all 9 months of your trial work period, then you move into what's called the extended period of eligibility. And that's 36 months. So 3 years after that, if at any time during that 3-year period, your earnings go below SGA, you're automatically eligible for SSDI again that month. So if you go back to work, you're successful for 9 months, Social Security then would begin to terminate your benefits, not terminate, but to stop your benefits. And then you work for another year after that, but then you have to stop for 6 months. Then you'd be eligible for SSDI for those 6 months, assuming you go back at the end of that. If you never go back, you could just continue to get your SSDI benefit. So there's no additional application process required there. No paperwork other than notifying Social Security that you've stopped working. Once they're notified of that, then they would restart your benefit. At the end of that 36-month period, there's another 5-year period called expedited reinstatement, where if you have to go back out of work during that 5-year period, they could expedite or speed up the process of turning your benefits back on. There is a stripped down application type process that's involved with that, so it's a little more involved than the extended period of eligibility, but it is a quicker process. The one caveat there is you have to have gone back out of work due to the same condition that you were originally approved for. Also, with Ticket to Work, you are able to keep and extend Medicare coverage while attempting to return to work. So after your trial work period ends, you're able to continue your Medicare coverage up to 7 years after your trial work period ends. So in order to take full advantage of incentives, you must assign your ticket to an employment network. Employment networks services are free, as mentioned earlier. It's free and voluntary, but you have to assign that ticket to an employment network, which if you go to an employment network, they can assign that ticket for you. You say you want to assign your ticket to an attempt to go back to work, and the employment network can take care of that for you. ENs, employment networks, are contracted with Social Security to provide or coordinate return to work services. So they're Social Security approved. They have a contract with Social Security to assist. Beneficiaries who have assigned their ticket to an EN are exempt from medical reviews. So as long as you have your ticket assigned to an employment network and you're attempting to go back to work and making timely progress for that goal. So the goal of the program is for an individual to re-enter the workforce. So there are benchmarks that you have to meet in order to continue to receive that exemption from the medical reviews. Medical reviews would be another name for that is continuing disability review, or CDR. You're exempt from those if your ticket is assigned to an employment network and you're making timely progress. Timely progress, so for like the first year, you have to earn at trial work level, which is around $800 for 3 months during a 12-year period. That would mean if you did that for the first year, then you would have met timely progress for that year. That is all I have. So for more information, there's some contact information here. You can call, email, or you could visit our website as well. Nicole, I guess it's time for questions now.
Yes. Well, first of all, thank you so much. Do you mind leaving that screen up for 1 minute, just in case somebody was trying to write down? There you go. Perfect. Emails and how to get in touch. This was so interesting and very informative, and we do have quite a few questions. The first question I'm just going to ask quickly is, when you talked about the employment network, what is an employment network?
Sure. So an employment network is an entity that contracts with the government to assist individuals getting back to work. So they may provide services like resume writing. They may be able to do job search for you. Voc Rehab also assists with that. They're not employment networks, but it's an entity that helps helps you re-enter the workforce is the best way I guess I can say that. Resume writing services, they can assess your limitations and what jobs you might be eligible for. They can also help you navigate and track the work incentives that you've used. So an employment network might be able to tell you, okay, you've used 9 months of your trial work. The next thing you should receive from Social Security is a letter saying that they're beginning the process of stopping your benefits, and you get 3 additional months of benefits after you've used your trial work period. Oftentimes, Social Security does not stop them in time, and individuals get overpaid. Most individuals, when they return to work, get overpaid because Social Security continues, which is why they utilize employment networks to help with this program. Is oftentimes claimants are overpaid. So employment networks can help prevent overpayments in terms of alerting Social Security or advising claimants on here's when it should stop. If it doesn't stop, hold on to your benefits because Social Security is going to ask for them back. Is essentially how that conversation goes. So.
Perfect. Thank you. How much impact does the fact if does it weigh if you are being covered under an insurance policy for long-term disability by an employer, as well as a separate long-term disability plan that the individual took out on their own? Should that be submitted with the paperwork with SSDI, and is that going to impact or impede their ability to receive SSDI?
Good question. So there are places on the application to list long-term disability companies because Social Security knows that there's medical involved there, so they will When you list that on your application, they will reach out to the long-term disability carriers and ask for their medical evidence. So Social Security and long-term disability carriers have they're two separate standards. Oftentimes, especially initially for long-term disability, they're looking at whether or not you can do your own occupation or the work that you were doing when you went out of work. And Social Security is looking at whether or not there's any work within the national economy that you can do. So as far as whether or not that evidence is helpful, a lot of times in long-term disability medical records, there are assessments already completed. So long-term disability carriers will send assessments to doctors to be completed. And those, assuming they restrict you from doing all types of work, again, age is a factor there, then they could be very helpful. If LTD, again, is just looking at past work and the evidence says that you can only do your past work, it may not be helpful. But I don't know if I answered that question well or not. There were multiple questions there, but you know, I think it's important to know, you know, what's in that file and what your doctor has submitted, because that information will go to Social Security. They will ask for it, and sometimes they are very helpful in that the long-term disability carrier has done the legwork, so to speak. So they've gotten the assessments already completed, and if they're supportive, then it could be very beneficial to your SSDI claim.
Perfect. Thank you so much. And again, if anyone had a follow-up question with that, TJ's contact information was just shared, and I'm sure that they would be more than happy to answer any other questions you have regarding it. Another question that we received, is there a difference in the amount you get when you change from SSDI to SS when you get to retirement age?
Good question. Yeah, no, so there's not actually. So if you were to be approved for Social Security disability at age 55, and you stayed on Social Security disability to retirement age, they would simply switch it to retirement at retirement age, and you continue to get the same amount. The one difference there is the COLA. So you'd get cost of living increases every year, but the amount would not change.
Okay. Is the SSA freeze also retroactive up to 12 months?
So the SSA freeze would be applicable so if your onset, so if the date of entitlement to benefits were in 2021, that's when that would be applicable, if that makes sense.
Yes.
So years prior, if you were disabled prior to that, out of work prior to that, but they didn't find Social Security didn't find you disabled until an earlier date, then that would not be applicable, if that makes sense.
Yes. Regarding the acceptable medical sources, would a dermatologist be considered an acceptable medical source?
Yes, assuming it's relevant to the impairment, then yes.
Okay, perfect.
So if it were a dermatologist and the condition, the impairment were a spinal condition, then that would not be relevant there. Social Security would look at it, even if one thing I probably should mention, acceptable medical sources have to be there in order to establish a severe MDI, medical impairment. Okay. Social Security will still take into account non-acceptable medical sources as additional evidence to support the claim, if that makes sense. So if you've got a chiropractor in the case of a spinal condition, that's still relevant. They just cannot use that to establish a severe medically determinable impairment, and their opinion in terms of limitations aren't going to be given as much weight as an acceptable medical source.
And is there a list so people can find what is considered an acceptable medical source?
I can send that to you. There is a list, yes.
Oh, perfect. Great, thank you. Another question is, does it matter where you live? So if I get approved in one state and move to another state, does that impact my SSDI?
It does not. It's a federal program. Where it does impact you is who makes the decision. So there's jurisdiction. So if you're in Illinois, each state has their own disability determination service place where they make the decision. So that's the only impact. But if you're on SSDI and you move, there's no impact.
Okay, perfect. Thank you. I'm going through, there's so many questions and they keep coming in. Another one is, I was denied SSDI in 2010 after 8 years of trying. Can I still reapply and receive it? I'm disabled and currently receiving SSS or SSI and will receive Social Security when I get to Social Security age.
So they're currently receiving SSI?
SSI, yes, but they were denied SSDI.
Okay. It sounds like if you're receiving SSI, then more than likely you were denied SSDI because you were not insured, more than likely, is the way it sounds. Because again, the medical determination is handled the same way. Whether or not it's SSDI or SSI has more to do with the technical work history type. But that does bring up a good question. It could also be, I take that back. It could also be the date last insured. So you're only insured for a certain period of time. So if you worked 5 out of the last 10 years, your insured status lasts another 5 years after you stop working. To say it a very simple way, it's more complicated than that. So you've got 5 years essentially to prove that you're disabled. If the disability occurred after the date last insured, you would not qualify. So if your date last insured was December of 2020 and you became disabled in June of 2021, it's going to be denied because the disability occurred after the date last insured.
Okay.
That's kind of in the weeds there and complicated, I understand, but that could have been the other situation. It could have been after the date last insured, which is why they may have been denied SSDI. Without knowing all the details of the case, I probably can't give an exact answer there.
Okay. Another question that we're receiving, there's so many in the chat now, and again, if you are participating through Zoom, please type in some of your questions in the Q&A just so I don't miss any. But one is that I've been approved for SSDI and the letter states that I'll be reevaluated in 1 year since my condition is expected to improve. But I've been diagnosed under spinal problems. What can I do?
Sure. So the important thing is to continue to see your doctor and seek treatment from your doctor, because when that review comes up, they're gonna get updated medical records to show that your condition is still at the same severity as when they approved it. That's not uncommon. I don't know what level they were approved at. Judges at the hearing level often will give shorter diaries. The way they do diaries also depends. They'll look at the evidence to see if there's improvement or they're expected to be improvement. Maybe there's a surgery coming up that they might expect some improvement. That might be what triggered it. Age is a factor. The younger you are, the more likely you are to have a shorter diary. But the important thing is to continue to see your doctor, talk to your doctor about your ability to work and support there, so that when the time comes, you've got the documentation.
Okay, perfect. Thank you. Another question, as far as representation goes, how does obtaining that work financially? So what would sort of the financial cost be for representation to the person living with pain?
Sure. Very good question. So Social Security determines how much a representative can get paid. And at 25% of any retro that you receive, so any retroactive benefits that you receive, up to a max of $6,000 is what a representative can charge for representing someone in an SSDI case.
Thank you. Let's see, hold on. I'm going to a document that has some more questions that we've been receiving. I think you already answered this one. If you're successful in obtaining SSA disability, what should one do to ensure that the reviews are also successful?
Yeah, it's continue to see your doctor, make sure that they get all the evidence that they need when the time comes. I don't know if the earlier question was, is there anything you can do about the review? There's nothing you can do about that, except Well, there are two things. Nothing you could do about changing that time frame. Social Security is historically behind in doing reviews, so it probably won't be timely. The one thing is that if you are improving, or if you think you might be able to go back to work, that would be where you could utilize your ticket to work and assign your ticket to an employment network, and see if you can sustain it. That's the good thing about the trial work period is they're not just going to cut you off right away. They're going to give you an opportunity to see if you're able to sustain the work. And as long as you've got that ticket assigned to an employment network and you're making timely progress attempting to go back to work, then those medical reviews, you're exempt from those medical reviews.
Okay. And then I know that you mentioned this, but I think individuals just want a little bit of clarity. Do you have to quit work in order to be considered for SSDI?
Yes. So if you cannot be earning over SGA or substantial gainful activity, and that's $1,300 for 2021. If they see that you're earning over that amount, that will be a denial. If they see that you're working, but you're working under that amount, it's not considered work as far as Social Security is concerned. However, when they adjudicate that case, they are going to ask the question: if an individual can work and earn $1,000, why aren't they able to earn $1,300 or more? If that question makes sense. So part-time work, they are going to consider that. They're going to ask the question: this individual is working part-time. Why aren't they able to work full-time?
Okay, that makes sense. And this is going to be the last question that we have time for. But do you have strategies for how to approach new doctors if you have to move to a different location and you have to find new providers to oversee your care in order to continue your treatment and the documentation process for SSDI?
Sure. I would say as soon as you are able to establish care right away, so you've got that continuation of care. Social Security is looking for a longitudinal medical record. They're looking for longitudinal evidence to prove that you've got a severe medically determinable impairment. So gaps in the medical records can be hurtful, certainly to a case. So the sooner the better. I would talk to your current doctors before you move and see if they've got any recommendations, and make sure that the new doctors get your records, your records from your old doctors.
Great. Well, TJ, thank you so much for joining us today. We are hearing from individuals how helpful you have been, how important this information is. And we just really appreciate your time. If anybody does have further questions, I know we did not get to all of them. Please know that you can direct them directly to TJ and his team, or you can also write into US Pain Foundation at contact@uspainfoundation.org, and we can help facilitate some of those questions. This webinar is being recorded and will be posted soon to our website. We will make sure that we pass along that link to everybody. And again, if you are looking for more support, more information about chronic pain and the resources that are out there, please go to uspainfoundation.org. We have a network of support groups. We have a pediatric program for kids and their families. We have a robust advocacy effort, an awareness magazine, and so many other things. Just know that you are not alone. And a special thank you again to Allsup for collaborating and sponsoring this webinar today. Thank you so much, TJ. We really appreciate it.
Thank you for having me.
Bye, everyone. Take care.
Bye-bye.